So let's talk additional written consent. There are a couple areas of the body that can be treated for specific conditions, but require additional written consent adjacent to the initial consent. The therapist must obtain this consent prior to treatment of these areas, as they are a bit sensitive in nature but can still be addressed therapeutically. The goal is to make sure a client has all the information to make an informed decision and be comfortable with the proposed treatment plan. It also provides reassurance and protection for the client or therapist, depending on the situation. Until 2017, the areas that required additional consent consisted of breast tissue and upper inner thigh. As a side note, we were taught in post-secondary that breast tissue was danger zone and the pubic area was no man's land. In May of 2017, the government passed Bill 87. This created the Protecting the Public Act, 2017, which amended the Regulated Health Professions Act, 1991. In response to this bill, the College of Massage Therapists of Ontario, or CMTO, they are the governing body for all registered massage therapists in Ontario. They updated the standards of practice all RMTs are expected to follow and expanded the list of areas that now require additional written consent prior to treatment. This list now includes, but is not limited to, breast and upper inner thigh, but now also includes gluteals and chest wall. Gluteals are starred because they are a sort of exception. A therapist must obtain the written consent before the first treatment of this area, and unless stated otherwise, they can accept verbal consent in future treatments for that area only. These areas are generally considered sensitive areas. This circles back to when I said, but is not limited to. The new definition of sensitive areas set in the updated standards of practice reads, any area or areas a client deems sensitive. This helps to provide care to victims of assault or other situations of that nature. There may be an area on their body that is uncomfortable for them to have touched. In these cases, the written consent gives them clear information of what will happen therapeutically and protection should treatment not go accordingly. Should a client happen to change their mind during or before treatment, a good therapist will document that on the additional written consent form for updated record on the client's behalf. To expand on something I've referenced a few times now, there are always a few bad apples in any bunch. Not all HCPs become HCPs for the right reasons, or get led astray and commit some sort of malpractice, assault, or abuse to some in their care. This updated standard is striving to eradicate these incidents within the massage therapy profession. Bill 87 is striving to eradicate these incidents as a whole in all healthcare professions. The written consent now supplies clients with documentation that assures their safety if work is being done in a danger zone or no man's land. It also helps their case if they have an experience with a bad therapist and need to pursue legal action. There are always records and reports that anyone in the public can go to that show therapists who are under investigation or have had their license revoked for misconduct. I'll link that down below. The few who do commit a misconduct in this specific field certainly don't help fight the stigma that most have surrounding massage therapy. The new additional written consent helps protect against misconduct, and education through seminars and social media actively change the perception of the public towards massage therapy practice.